Hello and welcome to another episode of Sisterhood of the Scalpel. I am Dr. Julie Khanna, a board-certified plastic surgeon.
And I'm Dr. Maryam Zamani, also a board-certified plastic surgeon here in Oakville, Ontario.
And today we're going to talk to you about upper and lower eyelids, an operation that we do a lot of. And it's kind of funny, isn't it, Dr. Z, that for us, this tends to be like a smaller operation at the end of a day, a nice little easy thing. And people worry so much about it. And it makes such a huge impact on patients. And more patients are talking about eyelid surgery. So we want to just help you understand how we look at it, a little bit about the anatomy, and to see if it's good for you guys.
There are certain muscles around the eyes in the forehead that move the brow up, but there's circular muscles around the eyes that actually bring the brow down, especially here in what we call our glabella area, but what sometimes people call it getting the 11 sounders, because these muscles are so active. And because these muscles are circular, they actually also get activated a lot of times when we smile. So that's how we get the smile lines around the eyes, or sometimes what we call crow's feet. The reason we address this is because if your eyebrows are low, if your muscles are really active and pulling things down, that actually affects the position of your eyelids and how much extra skin or hooding we can get, especially in the upper eyelid region. So the first way that we actually look at patients when they come in to see us is we do a top-down approach. We're looking at your forehead to see how active those muscles are. We're looking right here to see how much strength they have, how much they're pulling down on your brows in the middle, and also even on the side. And there's a variety of ways we can definitely address this, but the first step, always the first line of approach, is to use neurotoxins such as Botox to selectively weaken the muscles that are pulling everything down, so that the ones that are pulling the brow up can do their job and they can go unopposed. The second part is we actually start to look at around the eye. Okay, there are two components that typically go into giving us, sometimes a more tired or puffy look around the eyes. Either it's extra skin, or it's a little bit of enlargement or falling out of these fat pockets around the eyes. We have two fat pockets in the upper eyelid area and three fat pockets in the lower eyelid area, as you can see in this picture. And one of the things I like about this photo is that it shows if we do an upper eyelid surgery or a lower eyelid surgery and we need to take out skin, where we hide those incisions. And as you can see, we hide them exactly where your natural eyelid creases or just in the bottom of your eyelashes are. So they are very well hidden. There's no such thing as invisible or scarless surgery, but we do a really good job of hiding it in naturally existing lines or shadow areas. Okay.
I am going to point out one thing there, Dr. Z, on that photo, is that on the upper eyelid, that scar often goes out a little bit past the crease, and we follow one of your natural crow's feet or wrinkles in there, because some people do have a little bit of a hood on the side there. And we don't even follow the same crease on both sides, because we've got to follow what's naturally there. Because, as you said, we don't not make scars as plastic surgeons. We're just way better at hiding scars as plastic surgeons.
This last photo, what I really want to bring to attention is that as we're aging, we have fat around our face, and that the position and the amount of fat we have around our face changes. Okay, so as we're aging, we get a little bit of loss of the fat in this nice cheek area that helps blend the portion from the lower eyelid and to the cheek area.
Well, I think that was an excellent summary, Dr. Z. So what do we do when we look at patients? And we start always from top to bottom and work our way down. And we look first at brow position. Where are your eyebrows? Are they sitting high? Are they sitting low? And, even in this first patient, I want you to notice it's almost like a little bit spocked. And this isn't because of Botox. This is because of the heaviness of the eyebrows. We're trying to unconsciously hold our eyebrows out of the way. So we're holding up, we're working very hard. And if you'd see her forehead, you can see it on the bottom photo there. You can see all those lines in her forehead, because unconsciously it's just trying to get that skin out of her way, because there's so much skin. And this is really important to notice and pay attention to, because when we remove the skin, look at the next photo. Those lines are much better. Why? Because she doesn't have to hold the skin up anymore, because the skin's gone. And some people will say, Dr. K, Dr. Z, you dropped my brow. It's not that we dropped your brow. We took away the reason why you were holding your brow up. So you can see on her pre-photo, her eyelid skin is touching her eyelashes. On her post photo, you can now see a nice eyelid crease, and you can see that lid margin showing. And you can see that brow has come down and relaxed because it doesn't have to fight so hard. On the lower lids, we've taken out a little bit of skin, but just like Dr. Zamani talked about, what's the key here? The key is blending the cheek into that lower lid and giving a smoother transition. So look at that lower post photo, and you can see you've lost that big valley, you've lost that big hill. So we've taken down by removing fat, but when we do lower lids, we add fat into that little tear trough, into that sunken zone to make that transition between cheek and lid margin much, much smoother. Let's look at the next picture that we've got here. And you can see this upper eyelid lift. And this is a little bit early post-op, so you may sort of see the hint of the scars in the post-op, but you can also see that they're following exactly the previous lines, the natural lines of the patient's eyelids. And as they continue to fade, they're just going to continue to fade more. But we can see that lid margin. The eyes look bluer, they look brighter. Everything looks just a little bit more open. And if we go to the next one, again, look at that lower lid transition. We're getting that, taking down that bump, bringing up that valley to give a natural, soft look. And the lid combination with Botox can really make a huge difference. Well, you can see this gentleman, he had his lower lids done. And, he didn't want to look like he'd had surgery, but he just hated these huge bags under his lower lids. And he was also really conservative. He didn't really want a lot of fat grafting. He didn't want a lot. So this is a conservative approach. We took out some skin. We took out some fat. He's just thrilled. He looks brighter. He looks a little less tired. And he just didn't like people pointing it out. And it was the first thing he noticed when he looked in the mirror. And we've taken that away from him. So again, we're going to do what every individual patient's pros and cons, we discuss together what's right for you. What's the ICLS Advantage for upper and lower lid surgery? I would say one of the most important things is when we're injecting fat, you guys have probably all heard about the vampire facelift where we mix PRP, which is using your own blood as a filler. When we do fat grafting around the eyelids, we always mix it with PRP. So that's a huge ICLS advantage. Also, when we're removing skin, remember, we're talking about the quantity of skin, not the quality. Well, we have a lot of things that can change the quality of skin. We have lasers, we have eye-tip thermage, we have resurfacing lasers, we have halo. So there are a lot of options here that we can use, and never forgetting great products. We have great products that sort of help give that finishing touch and glow back to your skin, even around your eyelids when you're thinking about surgery.
One of the biggest aspects of ICLS Advantage to me is the fact that we don't have a cookie cutter approach to every surgery. We listen to our patients and we look at that and we offer this unique tailored experience for them. What is it that bothers you and what kind of results are you looking for? Not every single patient needs the exact same surgery, and that's why we really involve you in the process, whether you want something that's more noticeable or something that's very conservative. That's all a treatment plan that we come up with together.
It's all about looking like you, looking natural, looking soft, and not overdoing it, because the best plastic surgery is the one you can't tell anybody had done. So recovery time for an upper lid lift or a lower lid lift usually is about 2 to 3 weeks max, because that's how long it takes bruising and swelling to go down. If you have a good pair of Jackie O sunglasses, you will be out, add a mask to that. You'll be out doing your groceries and doing things like that. But you don't want to maybe have a Zoom meeting without makeup till about 10 days afterwards. After that, you'd be very comfortable about 2 weeks to 3 weeks walking around with a touch of makeup.
Absolutely. And whether you wear prescription glasses or not, having glasses with actually a frame around, much like what I have on, is a really good complement for this kind of surgery, because believe it or not, it does distract from your actual eye appearance. Now, believe it or not, I have this really fancy cat eye going on, but when I put these glasses back on, you're not really paying attention to that. Hence why I have to have the lipstick and the blush as well to balance things out. But that's actually a really good tidbit to give patients as well. Get a pair of non-prescription glasses from the drugstore, even if you must, and it really does take the attention away and people don't even notice it.
I hope you enjoyed this episode of Sisterhood of the Scalpel. We look forward to seeing you again. Please don't forget to subscribe, I think it's down below, to our channel, and follow us on Sisterhood of the Scalpel and also on ICLS